Yes, a very warm welcome to today's talk. And it's Emmanuel here. I'm a medical clinician in this refugee hosting community in northern Uganda, that is Africa. We are a very big community with different experiences in health, and it's a very resource limited community in terms of the health settings and also the different logistics in whatever we do and what we handle to improve our health system. So if you're for the first time on this channel, I would love to welcome you. In this channel we discuss different health insights affecting this community. We share resources, we share different ideas, and also getting different experiences from other parts of the world, whether in Denmark, whether in USA. We have so much engaged with many people around the world to see how we can day by day improve and communicate more on the health basics. So today I would love to speak about issues of vaccines. You know, vaccines these are drugs which are given out to healthy people to prevent some diseases which are so much common among us people. So in the process of giving these drugs, it can be attenuated vaccines or even live ones, which are really given to every age groups, more so children, because if you come to this community, on average an infant who is born today in a period of 2 weeks has to get another vaccine, different vaccine introduced to the body. And we know all vaccines have side effects, at least that was reported many times, and this is what people really don't talk about, the side effects. And vaccines are also more made up of what we call the adjuvants, which this one makes it potential to prevent the common diseases which are being injected against. So these adjuvants are mostly aluminum oxide, what they call the alums, which can really be so much bad. I'm not saying it's so much bad, but anything introduced to the body has to have some side effects. But this is what people much do not talk about it. There are a lot of advocacies about vaccines. So in the most recent years, this is what we call the people's vaccine inquiry. So many questions have been asked about the different vaccines in the recent COVID-19 vaccines, the Pfizer's, the Moderna's, which were mostly introduced to the people of different culture, different races, and also different parts of the world. And you find in the process of introduction of these vaccines, the medical ethics of autonomy, whereby a patient having a right to receive or even deny a treatment is really so much ignored. That question has really been not answered yet. Why many employees have lost their jobs as a result of not taking these COVID jabs. In the different parts of the world, this one has been reported. Even in my places, many schools were demanding for vaccine certificates of COVID-19 possibly. If you have taken the jabs, at least you're allowed to sit in the exams. If you have not taken it, there's somehow relaxances in disturbances when you sit for this. This has been reported in different African schools, more so the community schools where I almost visit every time. So you find this raises a lot of questions about the medical field, how this noble profession has really decayed because of what we call more often the medical industrial complex, whereby there's more of profits making than really the beneficence, which is really a big medical ethics of really ensuring the total benefit of health to these different patients, which we really consider that we are really helping. So you ask yourself why people don't so much talk about the different side effects which are really come with this problem, and there are really bad adverse side effects which are really reported. More so the endocarditis, a lot of inflammatory cases, and also a lot of issues affecting these different communities where we day by day visit to see how. So this must be much talk about to see how we can ascertain and also educate the different communities to see how they can impact also on their life, and also take charge of their different lifestyles pertaining their health, and also in sensitizing them educating them about the different adverse effects of these drugs, and they also take responsibilities other than hiding these stuffs and also not speaking so much about the different issues affecting them. So this must be much talked of, and in the subsequent videos we shall be digging so much about some of the few findings in this refugee community and also the rural settings of the world, to see and also have their say about the different effects and also possibly the benefits they have gotten from these vaccines, which are more or less a bad crisis currently. And if you want to get a follow-up of these videos, you will consider subscribing to our channel and also not leaving behind the different comments, sharing these videos, so that we see how we can together share the experiences and also improve our ideas about this. So thanks so much, and we'll meet in the next video.